Hi everyone, Phoenix Kawamoto for the Greater New Paltz Community Partnership. Welcome to Insights. Today we are talking about opiate abuse and heroin. And today we have Dr. Ray Harvey from the Institute for Family Health and also Step One, correct?
That's true.
And I've had the pleasure of working with Dr. Harvey on a number of different initiatives, and I'm really excited that you were able to come in and talk with us today and share some information. So thank you and welcome, Dr. Harvey.
Thanks for having me, Phoenix. I'm Raymond Harvey. I've been medical director for Step One for a few months now. It's an outpatient treatment program for alcohol and substances, and the main one I work with is opiates. I've since coming to the Hudson Valley in 2007, I became aware of this problem with prescription opioids and lately heroin. Heroin has made a big resurgence. In 2011, Tom Frieden, the head of the CDC, declared a prescription opioid epidemic because he was given the numbers, and the rate of death from prescription opioids was just climbing astronomically. We thought in 2013 we had turned a corner, and it seemed to level off. The new numbers are in, and we didn't turn a corner. In 2014, there was an increase of 16% in deaths from prescription opioids. So, and at the same time, heroin went from about 2,000 in 2010, 2,000 lives taken in 2010 to over 10,000 in 2014. Well, I think it's important to know that this affects everybody. This cuts across all demographics. And in fact, if you read the New York Times lately, 2 days ago or last week, there was a headline about how deaths from opiates have increased in every county in the United States, virtually every county in the United States. So it affects everyone. In children, ages 12 to 17, there's about 2% use of prescription off-label use of opiates currently, and I think there are over 16,000 active heroin users in that age group in the United States. So it affects everyone. It affects our children.
Dr. Harvey, when we think about opiates, what are some of the actual drug names that would fall under that category so parents can maybe be more aware of what they have in their medicine cabinet? Mm-hmm. And we've also been doing a lot of work here in the Hudson Valley, especially Ulster County, in the Prescription Drug Abuse Task Force, which I know you're involved with, as well as our local efforts. But, what would be some things that you think parents would, the different types of drugs that fall into this category, and tips that you would, offer them as far as what to keep an eye out for? Or...
Sure. Well, the main ones, of course, are the pain medications and cough medicines as well. There are cough medicines with opiates in them. But the drugs, specifically codeine, hydrocodone, oxycodone, morphine, fentanyl, methadone is one that's particularly problematic. Methadone, as used for pain, is not done well. It's responsible for about a third of the deaths in the country. That's over 5,000 deaths a year just from methadone, as used for pain. When it's used for addiction treatment, it's effective. It's kept people alive. Not without problems, but it's kept people alive. But what you would look for is, well, certainly any change in behavior, moodiness. What you worry about is there are several ways people overdose and die, and one way is using alone. And the classic is an adolescent comes home, says, "Mom, I'm tired," going upstairs, and walks right upstairs without being seen, and proceeds to overdose on whatever they've already taken. So, but the signs that you might see are pinpoint pupils, excess sleepiness. So.
Mm-hmm. So, Dr. Harvey, we're going to be doing a Narcan training here in New Paltz in the very near future. As we get ready to wrap up this video content, what can you say a few things about Narcan and the importance of that training?
Sure. Well, the Office of National Drug Control Policy have three sort of pillars to help get us out of this predicament we're in. One is better prescribing. Another is better treatment of people who are already affected. And the third is harm reduction. Harm reduction, specifically Narcan. Narcan is an opioid overdose reversal agent. And we train people to use it, and it's available free from the Department of Health. So it's something that if somebody is overdosed on an opiate, it can save their life. It's a quick administration. It works in about 3 minutes, and it saves lives. I've helped train the sheriff's department, some of the local police, as well as the outpatient treatment programs and detox in the area. And just from 2 small police forces, I think Saugerties and the town of Lloyd, they've saved over 20 people in the last year.
Yeah.
So it's really effective.
And I know our New Paltz Rescue Squad, as well as our New Paltz PD, have also used it and saved lives as well. So again, we're really excited to be able to help bring resources here to the community and to those of you who are viewing. Please stay tuned. We will be sending out announcements both through public access, our Facebook page, and upcoming communications on the Narcan training. And I thank you so much for watching, and we'll see you at the next Insights episode. Have a great day.